That's the Chili King of Thailand about to get the spicy Dr. Rahim adjustment.
Oh my God, oh my God.
Welcome to the office.
Just keep walking several times. So as he's walking, we can see an external foot flare more on the right side than the left side when he walks. Now, so they both kind of go out, but the right one goes out a little bit more when you walk.
Okay.
So he probably has a little bit more wear and tear on the back right heel of his right shoe. Keep walking, sir. All right, walk on your toes, please. On your toes, walk towards me. More pain in the back?
No.
Same.
Same.
Turn around, walk on your heels, please. Heels. So you can see the side shift. It kind of goes side to side. There's more of a lateral shift this way, side to side. That's the fixation in the SI joints.
Okay.
Walk normal one more time and we'll get started. Parents, this is your full spine x-ray. This is looking at you from behind. This is the right side. This is the left side. This is looking at you from the side profile. These are your discs. And we're going to talk about the posture and everything when we get there. We're going to start on this x-ray. And this work is based on the level foundation principle. I want you to think of this as a 24-story building and 24 bones that move. And this is the foundation of the building. In order to have a stable building, we need a level base and foundation. And that's what we have to look at first. The other thing we're going to talk about after the structure is your digestion. The digestion is pretty bad.
Yeah?
Yeah, we're going to talk about it. I'm going to explain it all to
Okay.
you, okay?
Okay.
So first thing, let's look at the foundation. Do we, just basic before we go to numbers, do we have a level base and foundation? No, we don't. We can see the right side is shorter than the left. You tilt on that right side. Do you see that? I need you to see what I'm...
Yeah, I see right is lower.
Yes,
Absolutely.
so the right is lower, the left is...
Is this from the...
This
is the real right side?
This is the right side,
Okay.
this is the left side.
Okay.
So the right side is dropped down,
Yeah.
okay?
Yeah.
The left side is up a little bit. You can see, I'm just going over layman terms right now.
Okay.
This hole is bigger here, this hole is smaller here.
Yeah.
Yeah?
Yeah.
Okay. You can see this is your tailbone, there's a bend here in the tailbone. There's one thing that was not explained to you, and this is going to explain all your stuff in your low back.
Mm-hmm.
You have an accessory joint here of L5. I don't know if you were told this. So what's happening, this is probably back when you were a kid, maybe you developed this way. I want you to see this. This is the transverse. This is your L5 wants to fuse to your sacrum. Now, in about 10% of the population, typically we have 5 bones that move in the low back called the lumbar vertebrae.
Mm-hmm.
5, 12 in the mid back called thoracic, 7 in the neck called cervicals. I'm referring to your L5 vertebrae here, okay? Your L5, you can see, these are what's called the transverse processes. And these transverse processes are attachments for the muscles and ligaments. Your L5 transverse, this is called a spatulated L5 transverse, is creating an accessory joint here on the left side. So instead of having that space there, it's trying to fuse there. And conversely, it's now starting on your right side. So what...
Is it a bone or is it a...
The vertebrae is fusing together.
Oh, okay.
So what the significance of that is you have a lot of stiffness on 5 and sacrum. So what is required then is we have to figure out your stability,
Mm-hmm.
and you will require more flexibility and stretching, okay?
Yeah.
Moving forward. In the population, 10% of even patients I see here have 4 or even some have 6, where the first sacral tubercle becomes more like a lumbar. That person needs more strengthening. So your scenario, I need you to see this. This is the reason why
So it's the left side, right?
the left side is high,
Yeah.
and the L5 is kind of fusing to that sacrum. So the key with hubby here, you got to keep him mobile. He needs to be walking, swimming, biking,
Yeah, I love to
moving.
do that.
And that's the stuff. So for him, it's not about heavy weights. You're right.
I cannot do that.
Correct.
Yeah.
And that's the reason why, though. So if you hit heavy weights, this all seizes up.
Right.
Yes.
Exactly.
And this is the reason why.
So that's we the last week we did 3-4 kilometers walking every day, and it felt much better already.
Because
after
of
walking.
because of the
Makes it
movement.
more, yeah.
Correct.
Yeah.
So I need you to understand this is the reason why. It's a L5 accessory joint. It's a spatulated transverse process. Now when we go to the side profile, look. There's your L5 disc. There's your L4 is worn out. This is over 30 years old, dude. This happened way long ago. Okay, this when I look at the shape of the disc, that's about 30 years ago.
That's possible, yeah.
Yeah. So that's what I see. Now, if
How you can see that?
that's how I'm trained. That's what I do. We all have our thing, right?
Yeah,
Everybody has their thing.
Yeah.
That's my thing.
Yeah.
And we were trained in this very particular by looking at the shape of the discs. I can infer a good time frame. And then I see other things as well. When we look at the sacrum, the tailbone, it should be a smooth arc. You got a tiny little nub there. That's an old tailbone injury. It's a tiny little one. I'm not so concerned about that with you. What my thing with you is I need to see what I can do here on this joint. So this is all, it's whiter here. You see that? Whiter.
Mm-hmm.
It's because you're putting too much load on there. And the reason why is you don't have enough curve in your low back. So that's what we need to work on while you're here.
Okay.
The idea is, and I'll go more in detail in a minute, we need more curve in your low back. Our number one line of defense against the forces of gravity is spinal curvature.
Yeah.
Once we lose the curve, then the whole series of events happen that lead to calcification. So, just to recap, we have a sacrum issue to start. We have L5 that's kind of wanting to fuse with this. So this has been taking up all the slack. Okay. Now, when I have people with 4 movable lumbars, I'm repeating one more time, it becomes that important to get movement here, or this wears out. Mm-hmm. And then this wants to fuse to it. Okay? Now, let's go back over here. Let's continue. So, we have the tilt. Let's go over the numbers now. And what do the numbers tell us? And now we're going to have some answers. Okay? Now it's time for some answers.
Because if I have this problem, it's always they always talk the hip is out of position, put it back, and then normally it's better. But that's when the injury is not too serious.
Correct.
Now it's quite serious, so it's different. But
and as we get older, it takes longer to heal.
Right.
I get that too, dude. Okay.
But if I see this, it's clear that the right side is
right side is lower. So now let me put the numbers together for you. We have a PI11 IN1 on the left side. We have a P4R rotated sacrum on the right side. We have a 3 millimeter drop of the sacrum on the right. That's from that tailbone injury I was telling you about. We have a measured difference. This is important now. We have a measured difference of 10 millimeters. If I fix your left pelvis, this is what's happening. The left side goes down 11 millimeters. If the left side goes down, the right side is up. Follow my process. Left side goes down. The sacrum on the right goes back. Yeah. So it's jamming in that left side. Okay? Right. If I push this up, it's going to make the right go down more. So that's not the answer right now. Yeah. Okay. Whatever happened this tailbone, this hip injury happened after this tailbone. Okay? This left hip, whatever happened to this left hip happened after this tailbone is an old injury.
That's like 30 years, what you said.
At least,
20.
yes.
Okay.
At least 30 years.
Yeah.
And what happened from that, there was rotation. It got stuck. It started to fixate. Then whatever happened here, so this was already there. Whatever happened on the left side, so I did this. Back and down.
Yeah.
Then whatever happened here caused this.
Yeah.
But I'm saying from what I see, it appears to me this happened after, because look, if I bring this gets worse. Yeah. So the balance we have to figure out is, I'm pretty sure we're starting on your sacrum while you're here. Okay. I have a few cases, probably about 4 or 5 cases like this that I manage. here in LA. And what I mean by that, I see them randomly throughout the year.
Yeah.
And especially when they don't do their movements, their walks and things like that, then this tightens up, they come in, they get adjusted. Okay? And there's a video I'm going to share with you later.
Great.
Of a case. I have it on my YouTube channel.
Okay.
Okay?
Perfect.
All right, so sacrum. Now let's continue. Let's move up. Let's go back up, and let's talk about the rest now.
Oh,
Are we clear?
There's more coming.
Are we clear on the foundation,
Yes,
ma'am? You understand?
It looks quite wobbly, like. Yeah.
And because of this, it's a balance. Now,
Yeah.
the challenge with your case here is this needs to be under 7 millimeters for adjustments to hold. The measure difference is 10. The actual difference, so we're not touching your pelvis, but we need to get this 3. That 3 came from there, but because of this, I don't see that I'm going to be able to lift that up 3 millimeters at the moment. I don't know. I'm going to see how you do over 1 or 2 adjustments.
Okay.
So the idea is we may have to put a heel lift on the right side. You may need a lift. Back in Thailand, are you more flip-flops or proper shoes?
Proper shoes.
Proper shoes, right?
Yeah.
Okay.
Yeah.
So it may be that we may test out a heel lift while you're here and see how your body responds.
Okay.
Okay?
Yeah.
That's that part. Now let's go back up. Now, digestion, I said, is something we need to talk about too. This you can get checked out back. There's looks like maybe a polyp or there's something in the colon there, white mass there. This is all undigested food. This is what I need you to see. So when we're looking at the stomach, there should be a gastric air bubble. You go back to my videos, I talk about this in almost every video. There should be a black half circle here. You have a little black circle there and a little one there. Then when I look at this is the ascending colon, transverse descending. This is all undigested food. We get to here, gas, undigested food as it comes out. So she's cooking the best food, but let me tell you something. You're not getting the value out of it because your body is not absorbing and assimilating as well as it could. And if we're looking at digestion, if you want me to go through the clinical terminology, if you were to go get this checked out, this is hypochlorhydria, low stomach acid, okay, hypochlorhydria, not producing enough stomach acid to activate the enzymes of digestion and acidify the foods to complete digestion. It's an easy fix. I'm going to give you a grocery list. You cook it however you want to cook. Most of this list, it's an anti-inflammatory grocery list. It's portion control. So your options are all there, okay? It's portion control. Does that make sense what I'm explaining to you?
Absolutely, because now I feel I cannot go to the toilet that easy the last
correct.
week
So
or something.
we're gonna work on that while you're here.
Okay.
So then we have this kink here in the upper back. And this kink in the upper back relates to your neck, relates to whatever's going on.
Always tension.
Yes.
Always. Yeah.
This is T1, T2, T3, T4, T5. This is the digestion area here. So it kinks like this, and then it has a hard kink here. And this area is part of the shoulder complex. It makes your shoulders look slightly uneven, but they're not. Okay? Now, let's continue up. Upper cervical is fine there, little tilting. That's fine though. Let's go over your posture, starting at the base. And the first thing I want you to see here is your posture. L5 goes through the base of the neck is fine. I'm okay with that. You have a little bit of forward head carriage.
Yes.
And the forward head carriage places a lot of tension here.
Yeah.
So the forward head carriage with T3, T4, you get a lot of tension here when you're sitting, standing long time.
Exactly. Yeah.
Okay. So we're going to talk about how we're going to reestablish some of these spinal curves. Yeah. And the most important thing right now is to figure out and see how we're going to move this.
Yeah.
That's the most important
Yeah.
thing. It's going to be a little spicy, but you like Thai food, so I think we're going to be okay.
Let her cook for you.
You want a chili
will
cup?
love it.
You eat chili paste, okay? So it's going to... This is actually kind of funny, guys.
He's a chili king in Thailand.
In Thailand,
Chili
yes.
king.
That's the chili king of Thailand about to get the spicy Dr. Rahim adjustment.
Oh my god. Oh my god. But
Shall we get started?
Yes, please.
And I think we're going to start here. Turn your head to the left. All the way, sir. Left hand here. Let the elbow relax down. Good. And that's the home run, brother. C1. Head down, please. I got you. Chin up a little. Excellent. Hold in, please. So we have the rotated sacrum on the right side. And we have to torque up in order to get the sacrum up on that right side. Let the right shoulder relax, sir. Good.
Oh!
And that's the home run, brother.
Oh my God.
Let him go now. Let him go.
Oh.
Välkommen!
Holy Moses. That was a big one.
I'm gonna let you walk. That was easy. Hold my hand, please, sir. Hold my hand. I got you. I got you. Hold my hands. March in place. All the way up.
Wow.
That was deep.
Yeah, you cannot tell anybody what that was for feeling.
You have to experience it, right?
Oh my
It's
God.
a
Yeah.
different experience. Let's walk now. Walk it out. 3-4 times back and forth, please. Walk it out. It's gonna be different. I just broke up all that scar tissue. It's not used to it. It's gonna feel a little weird,
Yeah,
sir.
it feels on the left side some, yeah.
That's the joint that was stuck, that accessory joint. Just keep walking, sir. And I said it's gonna be a little spicy.
Yeah, it was,
Lot.
but it's sometimes spicy is good.
This is a African spice.
That's the African spice.
Tanzanian spice.
That's the kukupaka. That's the
And there,
pili umbuzi.
Dar es Salaam, right?
Dar es Salaam.
Yes.
The house of peace. Now it's easy, okay? Chin up, sir. Home run. A little more. Drop. There you go.
Walk it out.
Walk it out. Walk it out.
So now it's more easy to you to
Yeah.
get.
Absolutely. This was the, you call it a home run. It was really a home run.
That was the home
That's-
run.
The whole week, you know, you feel something inside is totally wrong, but you don't know what to do. You don't know what to move, but it was quite something what you moved, I think.
So the walk I normally recommend 15,000 steps a day, okay?
Yeah.
Please have a seat, let's continue. Let's run the meter down the back. Let's see what we find. Take a nice deep breath in, sir. Blow it all the way out. Deep breath in and out. Neck is clear. 0. That also cleared the base of the neck, which I didn't touch. So we did a good... That was a good educated guess. Mid-back is clear. T12 is clear. S2 is clear. Check this out.
Wow.
Check it out. Watch. Remember L4? That's fine. L4, L5. Do you remember S1?
Yeah.
Remember this one?
Yeah.
That's the one I adjusted.
Yeah.
That was,
It's more flexible, eh?
yes. Less sharp.
Yeah. No, not sharp at all.
Breathe, sir. Breathe. Can I tune up the rest of you now?
Yes. Please.
Ears. Shoulders. Let me do the work, sir.
Yes.
AI shoulder. Nice. On your back, sir.
Ooh,
I'm
that's-
doing the ankle. Right, left leg up. Sorry, straight leg up. Down. There you go. Sit up and turn now. Take your time. Now you get the buff and polish.
This is much better already. Yeah.
Good. All right, sir.
Wow.
you to tell me what's different.
Now the difference is that I feel right away. The difference is when I walk in here, I was very scared to sit down, to even stand up, but now it feels like it's gone.
Sit on the floor. Let's test it.
Oh, this is difficult part.
No, it's not. Sit on the floor. Test it. Don't be scared. Don't be scared. You're fine. Don't be scared.
Okay, like this.
Just sit. No, sit.
Sit.
But here's the test. So
Okay.
let's go back to you were scared to sit, right?
Yeah. This morning when I wake up, because I slept on my back, it took me 3-4 minutes to only come from here.
Mm-hmm.
I need something
Yeah.
to get, and I push myself up with the.
Yeah, but not now.
But now it's like.
Let's see.
Just do like natural way.
No,
Now
I don't-
just stand
I'm
up.
still scared, but I can.
Don't be scared. Stand up, dude.
Yeah,
Come on.
yeah.
Khalas.
Mamma mia.
Voila.
Mamma
It
mia.
was mamma mia.
Voila.
It was a home run, but it's gone. It's amazing.
Last walk, please. Very good. And then the last
And
thing
the
I want.
whole week, you know.
Yeah, it's
Oh.
difficult.
Yes, he saw it, but
I
Oh
have
my
to wake
God.
up every 2 hours. To
I
carry
didn't drink water
toilet.
because I'm scared to go to the toilet.
You're fine now. Don't worry.
I'm fine.
Check
But
the hands.
okay,
Let's check the hands.
thank you so much.
Hold on.
What we can do without you.
I'm not done.
Oh.
Oh.
I gotta do the hands. Squeeze. Relax. Squeeze. Relax. Squeeze. Relax. Little bit on the lunate scaphoid. Easy. Scaphoid. Squeeze. Same thing. Do you use more computer, laptop, trackpad, or mouse?
No computer. I use the
The
iPad, the
trackpad.
Yes, right.
Okay.
Yeah.
There you go. Squeeze. Squeeze. That's where we're going to start, sir. Questions for today?
One question. Small thing in my feet,
On your back.
and I have it many years, and I think about it now suddenly. Sometimes I have a foot massage in Thailand, and if they touch this here,
It hurts.
it's
Fibula.
like it's shooting.
Okay, go on your back. Let's take a look. I may need your help in a second, okay? So let's evaluate the ankle a little bit closer. Raise the right leg. And down. Talus. Let me do the work, sir. Talus is the keystone bone. It's already set though. That's moving fine. This is the fibula. He has a posterior fib. We're going to come from the back side here. I'm going to do this 2 ways. Actually, first let me pull the talus. Can you hold his leg for me now? 1, 2, 3.
Oh!
That's the home run, brother.
That was it's in my back.
Your
Is that
back?
right?
That popped here.
But in my back I feel
A
something.
little twinge.
Yes.
It's okay.
Okay.
We got it. That's it.
Yeah, I feel.
Now watch. Hold it. Posterior fib. Walk it out now. Check it out. More better. More better. Walk on your toes, please. Walk on your heels. Touch that spot again. Touch the back of the fib. Should be different now.
Yeah.
Voila!
What did you do?
I adjusted the ankle, the talus bone, and I adjusted the fibula. It was posterior. I pushed it forward.
Is it like a nerve? What?
There's a nerve and muscle there,
Okay.
and it was irritated because of the alignment of the bone was forward. It was irritating the muscle and the nerve.
Thank you so much.
You're all set, my brother. I'll see you on Monday.
Absolutely.
Have a great weekend
You too.
and 12 to 15,000 steps a day.
And
Okay.
once again, I'm very happy and thank you so much
You're
because you really change lives. I think with you don't. I think many people talk like that, but the whole week in bed was a nightmare. Huh? It was so painful.
Yeah.
And then after this, it's like yeah, I don't know. What to say. Good morning, Dr. Rahim.
Good morning, Erwin. Nice to meet you again.
Yes.
So we have the Chili King of Thailand visiting us.
I'm so sorry. But this is normally I always wear this, so I should wear it today also.
Sounds good. Why don't we have a seat and let's
Okay.
have a conversation.
Okay. Great.
Come right over here. And let's talk about it.
Yes.
All right. So you've been here about a little over a week and a
Yes.
half.
Yes. Right.
You came from Thailand.
Yes.
And why are you here? Why did you come?
I came for a vacation,
Okay.
but the vacation changed a little bit because I told you I carried a heavy suitcase and then something happened in my back.
Yes.
This is not the first time. It happened many times already in the last 10 years.
Okay.
But yeah, that's where I had the opportunity to see you because of course I knew you already from YouTube and yeah, I don't know why, but something happened with my back this trip, so maybe I had to see you. And
So let me ask you then, what happened? I mean, we saw you several visits over the past week, a little over a week.
before I came, I couldn't get out of my bed for 1 week. So I
Okay.
needed my wife, my daughter, took 10 minutes to get me out of the bed every day.
Okay.
After the first visit with you, I could walk already and everything was much better.
Fantastic.
This is the, I don't know, fourth or fifth visit, I think. But today, this morning I wake up and it was, I feel 100% normal. So no pain,
Wow.
no feelings, no,
Okay.
everything is great for me.
Now
So
let me
happy.
ask, Madame,
Yes.
why don't you come over here and join us if you don't mind?
Okay.
Take a seat.
Sorry, come take a seat. Now, how would you evaluate your husband
Okay.
from the day you guys came until today?
All right. The first day we came, I have to help him with tying his shoe
Yeah.
and then get him up from the bed and put him underwear. He cannot do himself.
Okay.
It's a little bit embarrassing for him, I know, but we have to do it every day.
What, to
So
just
it's
put
not-
on his pants?
I have to put on his pants, take him to the shower.
I was
Okay.
proud of it, but okay.
Okay.
All right. And then after the first visit, I was so happy because he can tie up his shoes and
Yeah.
he can do everything himself and it's quite good.
So he had a lot of mobility after the first visit.
Yes, yes,
It was sore though, right? There was soreness.
yes.
And that's okay, and that's what I talk about, right? When we're starting this process, that there is some soreness that comes along with it,
Yes.
but hopefully it wasn't too bad.
Today
Along
was the
the way.
first time there was no soreness as well. So
Okay.
the first few times, yes.
Yes.
After you did the sacrum, which was, yeah.
Yeah.
I never any chiropractor did it for me. So actually I want to say this because I visit in the last 10 years many chiropractors
Okay.
because I have issues. And actually this is the first time really you explain me everything. We took the X-ray. You explain me exactly what's going on, how we
Right.
can avoid it, how we can. So this is give me a lot of knowledge and makes me much more sure about how I feel now, because I even have the feeling even if something go wrong, I can handle it now. I know what's the problem.
You understand.
I understand
You
what's
understand.
because you explain it with the X-ray.
Okay.
It's like the body was, or like a house hit by an earthquake. It's like out of the. It's like and then a small push and it's fall apart.
Do you mind if I just do a brief?
Of course.
I'm going to
Of
go over that
Yes.
X-ray just brief so that
Yeah.
people will understand in case they
Yeah.
missed the first video.
Yes.
So guys, we're putting together his case, and I just want to go over briefly what was going on over here. And when we look at it, I'm going to go to the foundation because a lot of this was down in the foundation. And you can see on his X-ray, we're looking at it. The stuff we talk about here is this work is based on having a level base and foundation. And if we don't have a level base and foundation, then everything else above kind of doesn't hold as well as it could. We lose that stability. On the side X-ray, if you look, we're designed to have 60-degree reciprocating curves. In his case, there's a little loss of curvature in the low back, and there's a little anterior head carriage. But regardless of all that, we got to go to this foundation and what is the real issue. So if we look here at the foundation, we look at the numbers, it should start to make sense. What we had was a rotated sacrum on the right, and we have a PI11 IN1. So what that means is that the pelvis is actually, the foundation is doing this. The left pelvis goes down, and the sacrum on the right goes back. And the other part, or the piece of the puzzle that when I'm going over these x-rays, talking about, is this something that we can fix or is this something that is manageable? And in his case, I do need to point out that he does have an accessory joint, L5. And what's happening here is the transverse of L5 here is starting to fuse to the sacrum. So that's why, however this occurred, it created a lot of instability in his low back. Am I breaking this up? No. Everything we did was here in the sacrum, bottom right sacrum here. And what does that mean? That means he now has his mobility. Through the mobility, he finds his management. And whether that's finding someone in Thailand, or we have somebody in Singapore, or going to Europe, or you're coming back, and there are going to be periodic adjustments associated with this. It's not that it's fixed, you're done, and see you later. So I just want to be clear about that with everybody. Yeah?
Very clear.
We understand, yes?
Yes.
Okay.
Yeah, and the thing is that I saw many chiropractors, never ever somebody adjust the sacrum. It was always, they said the hip is out of position, and the pelvis, right?
Yes.
Pelvis, like they adjusted the pelvis, but never ever
But the hip was out of position, but here's the thing. In your case is if we adjust the pelvis, let me go back to this real quick. Thank you for reminding me on that. If we go to the pelvis and bring this, if it's down and we bring it up, it's going to make this worse because he has a leg length discrepancy. 10 millimeters is the measure difference. If we work on the pelvis, it becomes 14. It gets worse. So the fix here, or the stability, is really the sacrum first. And maybe down the road, as this is more stable, maybe adjusting it a couple of times if it's actually stuck. But it wasn't stuck.
In the last 10 years, nobody handled the sacrum, and actually that's the issue. So
all of it came back to the sacrum.
Right. So that's why I feel stability already.
Very
much better in my opinion.
Now, let's see what we got today, sir.
Oh, yes.
You ready for me?
I'm always ready for you.
Let's do this. Starting at the base. Got a tiny bit left here. 3-4 points in the atlas. This one washed out. Upper back is clear. So today, I got 1 point down low.
Okay.
1 point. So I have C1, and let's check the movement of your sacrum all the way back, sir. Good. Okay, look. This is your 5. This is S1. This is S2. This is what we've been working on. So
Right.
any pain?
No pain at all.
Good. Very nice. Let's do static palpation, please. Running our fingers down the spine.
Yeah, life can change in a week.
Life can change.
Wow, 2 weeks ago I thought, 1.5 weeks ago
It's very amazing. How-
Do we believe in miracles now?
Yeah,
but it's
it's
really.
very amazing.
You know, here's the thing, guys. There's a lot of techniques in chiropractic, okay? I think some people say there's over 100 different methods. And I got into this method because it made sense to me. And when you look at the Gonstead work, it's, you know, if you really break it down, it's pretty simple. Dr. Gonstead knew anytime we injured ourselves, there was inflammation associated with the injury at that joint. And he also said, always suspect a neuritis first, nerve pressure. And I believe that it to be true. I believe that in my heart to be true, that every single sick person has nerve pressure somewhere in their spine. And my job is to help find that. If there's no nerve pressure, there's nothing to adjust. Right? Nice and easy. And having all these methods, everyone has their thing. There are a lot of people that help a lot of people. And it's not just that, like, for example, people say, I'm not the end-all be-all for everybody. But when I go back to nerve pressure and I go back to the components of inflammation, that's really what we're doing here. We're looking for components of inflammation. And what are those components? I'm going to let you guys answer in the comment section what the components of inflammation are. So Gonstead was like, let's see if I can just stay busy looking for that. And he was seeing what, 500-600 patients a day in that clinic. Getting up, starting at 6 a.m. till 2 a.m. the next day. His philosophy was, you don't go to bed the same day you wake up.
Right.
Right? Sir?
Better?
Fantastic. I'm
yeah.
gonna just check up top.
Okay.
Sit back for me, please.
Yeah.
Very good.
How he's more relaxed.
Yes, much more relaxed today. Nice and easy there. And then it goes back to the intention. What is the intention? And with me, my intention, as I said, is my intention is to level base and foundation and find nerve pressures. Figure out what we can fix and what we need to balance and manage. Sir, we're going over here on the gray table. I have a tiny bit in the atlas.
Okay.
Left hand here. There you go. Nice and easy there. Good. Excellent. That's it. Head down, please. Sriracha, huh? Too hot to handle.
But not for Dr. Rahim.
Too hot to handle. Well, then we better ice you up. Now, I'm just bumping it a tiny bit to hold. Just a tiny bit. Just a tiny bit. Nothing hard.
Oh.
That's it. Perfect.
Oh my God. Yeah.
Got a little bit still. Just a tiny bit.
Wow.
Tiny bit.
Just a little bit.
It's a little bit for him, but it was it was less than last time. But
So
you
little
see,
spicy.
You feel I'm scared. Huh?
What's that?
I get it hot from
You get a little sweaty, don't you?
yeah.
When you're ready, sir.
Because no, it's okay.
Walk it off then.
Yeah, it's because the first 2-3 times it was like something like, oh my God, what's happening here? But, yeah.
Now here's the thing, when we're talking about low back adjusting, it takes about 70 to 75 psi to move a lumbar spine, lumbar vertebrae. Cervical spine is about 7 psi. So why does it look like we have to do so much more? I have to do so much more. I'm breaking through all this fear, anxiety, and tension. Have a seat, please.
Is it the right side? You did the right side or?
Center slightly to the right.
Okay.
Yes, sir. Raise your right leg and down.
Okay.
Raise your left leg and down. Fantastic. Sit up and turn for me, please. Let's go ahead and work on the ears, shoulders, over. Nice. Over. There you go. You're all tuned up, sir. Let's do the hands now. Over
Okay.
the hands. Squeeze.
It's okay.
Squeeze. This one is better. Squeeze. Relax. Squeeze. Relax. Good. Tiny bit on
Is
the
it more power or is it more? What
It's
what
a
you checking?
little. So what I'm checking, people are always asking, what am I doing here? It's just
Right.
something I do. And what I'm feeling for, we have the carpal bones here. We have the distal radial ulnar joint. We have the elbow.
Mm-hmm.
In the elbow, we have the ulna, and we have the radial head, and we have the humerus. So I'm feeling like the pulley system at the gym, that all the cables are seating properly over the pulleys. So when someone squeezes my hand, I can feel the little subtleties.
Okay.
And that's what I'm fixing only. So it's not just me going pa 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 pa.
Right.
Squeeze. Good. Tiny bit. Lunate, posterior. That's it. Squeeze. Squeeze.
And I'm right-handed normally, but okay.
You're all set with it?
Yes. Well, no,
Questions?
no questions because I feel great.
Okay.
That's if I still had something, then I have questions. But now it's. I want to thank you from wherever, from my heart, from everywhere, because yeah, what I said a week ago was a nightmare, and now I feel like life's back. So thank you so much, Dr.
I
Rahim.
appreciate it.
Thank you so much.
You guys have a safe travel
And
back.
we will be back for sure in LA to have another treatment. I want to check that you check it out again.
You gonna bring me some chili?
Yeah.
Yeah.
You
She
gonna
said
bring me some
already,
chili?
we wanted
madam,
to-
this time?
We
I
want
will bring you one container, put it for this building, one container,
Okay.
20 tons. Amazing.
Thanks.
Suffer
Again?
salamat, brother.
Okay, yeah.
You take
Thank
care.
you so much, and
You're
I
welcome.
hope to see you very
You
soon.
take care, my dear.
Yeah.
God bless
Thank you.
guys.
Thank you.